have surely heard the name Fender if you're a fan of rock legends like Jimi Hendrix or Eric Clapton. But what you might not know is that those iconic instruments also have therapeutic uses as well. The Johns Hopkins Voice Center, located at GBMC's Milton J. Dance Jr. Head and Neck Surgery Center, mends damaged voices of all kinds, sometimes with a little help from their friends at Fender Musical Instruments Corporation. I met with Barbara Messing, the director of the Dance Center, and Dan Sherwood, a Speech Pathology Clinical Specialist at GBMC, to find out more.
This is where we work with musicians and singers and people who are fronting bands, and we get a lot of indie singer-songwriters, high school and elementary school music teachers, so we try to simulate their environment as much as we can, and they feel very comfortable here. So this is where we work with our professional voice users for the most part.
And I guess nobody has to bring their own guitar, right?
They often do. Sometimes your own axe is the best thing, and we can set up on different type of microphones and work with them, and so we can again simulate what they do and kind of tweak the biomechanics and the technical problems that may be contributing to their vocal issues.
Explain to us how Fender's involved and where you got all this great stuff.
Yeah, they were kind enough. We had a connection through one of the doctors. Explained to a Fender representative that became our Fender representative that what we wanted to do here as the Voice Center grew and what we were doing to cater to more vocal professionals and performing artists, and it just all came together over time. And Fender ended up donating about $20,000 worth of all the gear you see here, all the guitars, amps, percussion, harmonicas, a ukulele. We've got a little bit of everything. They were very generous.
Can you tell me what a typical professional singer, let's say, what kind of problem are they having and how do you fix it?
Often there's just a lot of wear and tear in the vocal cords. That's what we see. They don't have any overt pathology that we have to surgically remove. Sometimes they do, but often it's just a technical issue working around a lot of wear and tear. Like, we get little bits of arthritis and wear and tear and rotator cuff and things like that. If we're active adults, well, singers, they're the athletes of the voice world, so they get wear and tear in the cords, and we have to learn how to work around that. Sometimes they do get overt pathologies that require surgical care. Sometimes we can see them and help them avoid surgery, just again, working out technical issues and using their body as their vocal instrument, not just their throat.
What would a regular person come in for?
Well, there's a lot going on here. Vocal rehab for all kinds of voice problems, not just singers and professional voice users, but anybody who we all have a larynx and we all talk, we all use it, and anything can happen. You can go to the Ravens game and scream your head off and blow a blood vessel, and next thing you know, you're still hoarse 2 weeks later and you come in and we have to fix it. And so we have that. We see a lot of school teachers who talk for a living all day long. They're athletes vocally, and like any other athlete who demands more of their body than the average person, wear and tear, and we have to rehab them. So this place is very busy in the summer with school teachers who are off, dealing with voice problems, get them back in the game for fall.
Well, the greatest thing about being retired is I can yell at Ravens games on Sunday afternoon now.
Yeah, true. Just be careful.
The Fender Music and Voice Studio is just a small part of the Voice Center's 5,000 square feet of real estate.
The purpose of the Voice Center is to help patients with voice disorders. We diagnose, find out what the problems are, and then we have a multidisciplinary team of laryngologists, voice clinicians, specially trained clinicians to work with the voice problems that they may have. So we were able to evaluate, medically manage, and also behaviorally treat. So it's a full continuum of care for patients with any kind of vocal problems. We do a lot of office-based procedures. For example, when someone has an aged voice and their vocal cords may become thin, and there's different procedures we can do to kind of plump up the vocal cords and help them the patient have a louder volume and a better voice production.
Like an injection? Or?
Correct, and we can do that right here in the office.
So that's medically?
Right, and there's different surgical procedures for removal of polyps and things like that that may grow on the vocal cords. Behaviorally, that would be voice therapy techniques that the voice clinicians would do with the patients.
And what kind of thing are we talking about there, voice therapy?
How to take care of your voice better, how to make sure you stay hydrated. Patients will learn vocal function exercises on things that will help mobility of the vocal folds and help the tissue to be healthy, and also to make sure that they don't have a strong impact when they're talking, so they're not slamming their vocal cords together. So maybe easier onset, breath control, making sure they have proper posture and breath control to produce voice more efficiently and effectively.
You're going to make me sit up now. The innovative Movement Education Studio is designed for body-centered therapy used to enhance body awareness and promote the physical freedom necessary for vocal flexibility.
And the whole philosophy is voice is a product of the body, not a product of the throat. A free voice cannot come out of a tight body. And especially with vocal athletes, because they're often in shows that require a lot of movement, dancing, strange positions, heavy costumes, cumbersome sort of things. So we have to help them with chronic aches and tensions that develop, head, neck, spine issues. So we have a whole movement room next door to this one where we have a massage table laid out, and we have exercise balls and various types of equipment and bolsters to help people relieve chronic nagging aches and tensions and all over the body that can affect free, easy voice production.
Happy sound can't come out of a sad grimace either, but...
We can fake it till we make it.
So, if you need a voice mender, come to Fender and Dance Centers at GBMC. I'm Don Scott.